I wanted to discuss a opinion paper that was written in the Journal of the American College of Cardiology. And this is interesting. Sometimes I feel like Sisyphus, just constantly pushing this ball up a hill and then constantly getting battered down. This is different than dealing with conspiracy theorists. This is real science, and these are real scientists that wrote this. These are top doctors and top scientists. And in the field of cardiology, most people agree that saturated fat is very harmful for you, but there is a subset of people that say saturated fat is not harmful for you, and they have written what is entitled Saturated Fats in Health, a reassessment and proposal for a food-based recommendation. This is the article, and it's fairly interesting. First of all, you got to understand, again, these authors are respected authors. They do have a scientific background. If you look at their disclosures, there's a lot of disclosures. Danish Dairy Foundation, the European Milk Foundation, Nestle, CrossFit, the National Cattlemen's Beef Association, the Dakota Beef Council, Dairy Management Honorarium, more National Cattlemen's Beef Association, Milk Producers Education Program, Dairy Farmers of Canada. The main author, Ronald Krauss, he has really been one of the biggest authors that has really tried to prove that saturated fat is not bad for you. He's had a lot of industry support for this, obviously, because saying saturated fat is bad for you, making dietary announcements that we should eat less saturated fat means a lot less money for milk, dairy, eggs, and meat. Interestingly, Krauss wrote an article last year where they compared red meat versus white meat and plant protein. And they were looking at LDL cholesterol. And of course, as you might guess, plant protein had the best effect on LDL cholesterol. But they turned that article really more into a study of red meat versus white meat and kind of ignored the plant-based improvement. That was called the approach trial. And it was interesting because you really got the feeling that if you look at food consumption in America, chicken consumption is going up like crazy as meat and dairy is going down. And so I think that Krauss, armed and sent to battle this by the Dairy Association and by the meat associations, wanted to prove that there's no difference between white meat and red meat when it comes to cholesterol, and he proved that fairly effectively. You also have to know that Krauss is very, very into the idea that it's not just about LDL, it's about LDL particle size. He has done some key research on this, and it is true that LDL particle size does make a difference. In other words, if you have large, fluffy LDL, you're less likely to get heart disease than someone who has tight, wound LDL. It's called small particle LDL. So this is important. But what you've got to understand is that even large particle LDL, if it is raising your LDL, if your LDL is elevated, you're at a higher risk of cardiac death. We know this from many, many different studies. There's a great study out of Northwestern that looked at this. There have been excellent studies, such as the Cooper study, that follow people that were otherwise completely healthy, no other problems, no diabetes, no insulin resistance. They just had elevated LDL cholesterol, and there was a very huge difference in all-cause mortality and in cardiac mortality in people that had elevated LDL regardless of any other factors. And then there's Mendelian randomization, which is looking at people that genetically don't have high LDL or have low LDL and compare them to a similar population that does not have this gene. And of course, if you have lower LDL, you have less chance of having heart disease and cardiac mortality. But let's get to this paper. So this paper, basically, it's nothing new. They're rehashing a lot of the old stuff. And so it's a good paper, and it's an interesting read going into the science of saturated fat and what it does. But he does, again, call upon a lot of old studies that have had a lot of problem. Like he goes into the PURE study here. The PURE study was a study where they looked around the world and they compared several different populations. They were looking at heart disease, they looked at fat consumption, they looked at carb consumption. And they actually found, believe it or not, the healthiest diet was a high fiber diet. So if you had a high fiber diet, you did the best. But they did show that saturated fat was not necessarily tied with heart disease, and that actually high carbohydrate was more tied to heart disease. And the problem here was the people that were eating high carbohydrate intake in the PURE study were people in places that had terrible sanitation and terrible medical care. This is very poor population. So if you're in a poor population, that's going to be a huge factor. They weren't eating a diet like that. They were eating basically just rice. And so they were an unhealthy population and they had diseases because of that. And the PURE study was just really not a good study because you weren't really comparing apples to oranges, or apples to apples. You were comparing apples to oranges. He then goes on to discuss epidemiology that has shown that saturated fat is not associated with heart disease. And let me explain this for a second. All right. If you're trying to show that saturated fat causes heart disease, saturated fat causes heart disease by increasing cholesterol. We know that if you put a person in a lab, that if you give them more saturated fat, it increases their cholesterol. And the higher cholesterol, LDL cholesterol, leads to higher heart disease. Okay, so that's the pathway. Now, when you do an epidemiologic study and you're studying a group of people, you want to do a multivariate regression analysis. In other words, you want to remove confounding factors. And it is considered, and of course the industries want to consider this, that a high cholesterol is an independent risk factor of heart disease. So in these studies, they remove people that have high cholesterol. So they're just looking at saturated fat to heart disease, which means they're skipping over the traditional pattern of saturated fat raising cholesterol to get to heart disease. So what they're doing is basically over adjusting. So by removing all the people with high cholesterol, you're removing the people that have an effect from their saturated fat that causes heart disease. You're basically almost guaranteeing that you're going to get a study that shows that saturated fat doesn't cause heart disease. You're removing the mechanism of action. And they have relied very strongly on that in their arguments to say that saturated fat doesn't cause heart disease. He then says the best epidemiologic study ever done to show that saturated fat and fat doesn't cause heart disease was the Women's Health Initiative. And, you know, that they looked at a low-fat diet versus a regular fat diet and didn't see much difference, except for the low-fat diet wasn't on a low-fat diet. They were on a 30% fat diet. They ate 32% fat diet. So they didn't even change much from what the control was. And that's what he's saying is a low-fat diet. That's not what I teach as a low-fat diet. I teach at 20%. Some people teach at 10% as a low-fat diet. And so that's not a very good study. So the studies aren't very good. So then he kind of transitions into discussing the fact that when you're eating meat and when you're eating saturated fat coming from whole foods rather than processed foods, and I agree with him. You know, vegetable oils and heated vegetable oils are not good for you. Trans fats are terrible for you. And he says if we're eating whole fat, whole foods, like you're eating actually a steak, it may raise your saturated fat and it may then raise your LDL, but it's raising your LDL-C. What it's not raising is your LDL-P as much, which means that if you're looking at the particle size, they're not raising the large particle size, and so therefore you're not as much of a risk. He's partly right about this. You are not as much of a risk if your large particles are increasing over your small particle, but you're still at risk. You're still increasing your LDL. If you compared it to a plant-based diet where we're actually reducing LDL, which he actually showed in his own study, the approach trial, you're even reducing the risk of heart disease even more. So basically, this paper is just a rehash of old studies that we've gone over again and again. I've had multiple different posts and talks about this stuff. It's nothing new. I do think it is a bit of industry trying to say, hey, because there's been a lot of studies coming out lately against saturated fat, a lot, and there's been some consensus papers and things from cardiology and others that have said, we definitely think saturated fat is not good for you. And so I think this paper was basically just a response. Hey, let's bring up these old situations again and let's add nuances like LDL particle size. But in the end, saturated fat is not good for you, and I do believe it should be avoided or at least minimized in your diet, and you just can't beat a high fiber plant-based diet when it comes to heart disease.